We're trying to find moments where, in the midst of all of this chaos, that we can speak with wise voices to help to give clarity and direction for these roads ahead. Even the format that we're using right now, where we're in the sanctuary but practicing social distancing all at the same time for this interview, makes this a little more complicated. But we wanted to reassure you at home that there is great wisdom to be found, and we want to help to provide some of that solid content for you. I'm pleased to be with Dr. Gillespie right now. Darria, it's really good to have you with us.
Thank you so much, Rich. It's great to be here.
I know that things are really busy, particularly in the medical community right now. Will you tell us just a little bit about your medical background?
Yeah, absolutely. I'm an emergency room doctor. I did my training up at Harvard and Yale, and now I'm a clinical assistant professor at the University of Tennessee and practice up at Erlanger in Chattanooga.
As a doctor, what is this like right now for the people who are on the front lines of this war?
Rich, right now, this is the sort of situations for which we trained, for which was why I became an emergency room doctor, but it's unlike anything I ever anticipated.
In what way?
And so in many ways, we are seeing quick waves of patients coming in, but what's really hard is that the guidelines are changing because we are all learning on the fly. It's not uncommon in a given shift that the guidelines for who we should be testing, how we should be triaging, how we should be best taking care of our patients change. And that's a good thing because we are learning, but it's also just a result of the fact that this was so unexpected.
Yeah. I'm sure it's a dynamic situation just for the medical providers as much as it is for anybody. How can we be praying for medical personnel right now who are running into hospitals to care for people in need?
I think as I'm running in, the sort of prayer that I suppose I would want to, for myself or for my team is to pray for the teams, to give them strength as they are getting fatigued, that we not get ill. I don't want to get ill, of course, for my own sake and my family's sake, but I don't want to get ill because if I'm ill, I can't take care of my patients. And I most pray that, we've seen these situations and we've seen what happened in Italy when they reached capacity of the ventilators. Yeah. And the biggest problem for me as an emergency room doctor isn't having too many patients or too much to do. The problem comes when I know what to do, but I run out of the tools to do it.
Wow.
If we reach that point, that's going to be a big problem. And I pray that we never reach that point, that all these other steps that we're doing will keep us from getting there.
Yeah. One of our great saints in the church said that we should pray as though everything depends on God, but work as though everything depends on us. And there are a lot of people that are blowing off the media messages of social distancing and limiting contact, staying from home, those kinds of things. Will you help explain in layman's terms why that's so important for society right now?
Yes, I am so glad you were asking about this, Rich, because at first we heard these headlines that the mortality rate is much higher in the elderly. And yes, that is still the case. That is the case with pretty much any disease out there, that it is higher in the elderly. But what we are seeing, I was talking to several of my colleagues nationwide, and to a person, all of them are taking care of people in their 40s and under. One hospital, half of their patients that are in the ICU for COVID are under 40.
Yeah.
Another friend of mine had taken care of a person who was in his 40s, and he was on the ventilator for 2 weeks. That is unheard of.
Wow.
So it is, in fact, true, while the mortality rates may be higher in the elderly, the severity of illness does not spare anyone. Everybody needs to take this seriously.
And in taking it seriously, we need to slow down the progression of the disease. So this isn't even necessarily for your own sake in social distancing. It's also for the sake of others, because if we overwhelm the system, then we're not able to provide the basic care and we experience horrible trade-offs. Can you explain what that's like so people understand it?
Yeah, absolutely. And I think at its hardest, what we saw in Italy is the reality is that we've heard the numbers of ventilators that we have and how we could run out of them. I've been talking to ICU doctors and we're figuring out how to put 2, 3, 4 patients on a ventilator. We're talking about rationing resources, rationing masks. But the truth comes to this, because there's already a small hospital in New York City that already ran out of ventilators. The truth is, when we run out of ventilators, when every single one is used, then the next patient who comes in who needs a ventilator means some patient is going to have to die. And that is a very scary thing. It is a decision that I hope no doctor in the United States has to make, but it's the truth, and we have to put it in that kind of black and white context for people to really understand that.
Yeah. Well, I appreciate you painting that picture for us. As dire as it is, it's important for us to, assume the worst and hope for the best and be able to do both of those things. So we know we hear all kinds of advice, but what are the basic things that people need to do in order to stay safe for themselves as well as others?
Yes, and I'm glad that we also talk about that, because we as doctors, we know what treatments to do for this. It's just most important that we have the resources and capacity to do that, and we can talk about what to do for it in just a second. But I've been hearing from people that they feel helpless. They are sitting at home, they aren't working, their kids are home, they feel like they're useless. So I have a couple of things that I want to tell them. Number one, if you are staying at home, anybody staying at home watching this, you are actually an active part of the solution. Social distancing is absolutely a part of the solution, because the number one thing somebody can do for the COVID situation is to not become my patient.
Yeah.
And to keep from being that. So social distancing, you being at home, that is active. So please do not think of yourself as being helpless. Number two is self-triage. One of the things we were talking about is that finding the people who will become sick from COVID amidst all of the other people who may get COVID, it's like the needle in the haystack. And so number two is for people to start self-triaging, because if you're just a part of that haystack, it's important to not come into the emergency department. So again, most people, especially if you don't have chronic conditions, aren't going to be okay. So I want you to self-triage. That means that from the minute your symptoms start, the reality is if you are otherwise healthy, you probably cannot get tested. But if you have fever, and COVID can present in many ways, but fever, cough, shortness of breath, body aches, and some people even diarrhea. If you have those symptoms, immediately assume you have COVID. That's what we're telling most of our patients, because we can't test most of them because we don't have enough tests. Assume you have COVID, self-isolate. But then the self-triaging comes in is because sometimes we're seeing people around a week in is when they start to get more severe. So this is when you need to self-triage if you need to seek care or not. High fevers, temperature 104, rapid breathing, difficulty breathing, chest pain, lethargy, not eating, drinking, or urinating. If you have those symptoms, then I do want you to seek care. Call your doctor, call 1-866-PUB-HLTH, or go to the emergency department if necessary. That self-triage is going to be hugely important to affecting that size of that haystack.
Yeah. Thank you for providing that kind of clarity on whether or not you need help. And I know that medicine is changing rapidly and will continue to change. I know that I've been in contact with my physician for a variety of things, and it's amazing to be able to do that through the internet, to send a message to your doctor without taking up their time and letting them to answer it on their terms. Because I'm sure there's lots of people for whom they have ongoing medical issues that need to be cared for that are unrelated to COVID, but the system is so burdened by not only the current caseload, but the anticipation of that caseload. How does someone access care now if they need regular things to care about?
I'm so glad you mentioned this, because yes, we've been saying for years that we should grow telemedicine, and that may be one of the silver linings of this, is that a lot of doctors are really needing, and a lot of health systems are moving to telemedicine right now out of necessity. But it's actually, I think, going to be a great benefit for people. So first of all, find out your own primary care doctor. They may be already using telemedicine, and you can just reach out to them, make a virtual appointment via them. Otherwise, there are a number of different other telemedicine solutions. Often you can access them through your health insurance or find them online. But first, go through your doctor, because many doctors who traditionally, my husband included, have never been using telemedicine. He's now seeing patients virtually, and many doctors are. So it's a great way to access care right now.
As you mentioned, you and your husband are both physicians, and we do pray for you and other nurses and care providers and the people who are making difficult decisions and trying to diligently care for people. But you also have a family, so tell us about your family.
Yeah, so I have two little munchkins. They are 3 and 6, and they are home.
Yes.
So on top of all of it, I'm trying to figure out how to teach at the kindergarten and preschool level. It's an unexpected challenge.
That is such a disruptive thing to all of a sudden, have your kids at home and to try to, particularly in early childhood years, try to figure out how to do distance learning and online education. Do you have any bits of advice for families that are dealing with the oh no from the first week of doing this?
Yes. And maybe my advice is partly from my own errors or experiences in the last week. So this one I'm no expert in. And for all the parents who are at home right now, there are times when I think I'd rather go in the ER and take care of some COVID patients. It may be easier than dealing with everything at home. So it's hard. So a couple things that we're trying to do. Is give ourselves a little bit of grace. I know even my own children, if we stick to this regimen, it's different, it's unusual. They don't understand why we're doing it this way. So we aim to reach the goals of the day for activity, but if we don't, it's okay. And trying to read them as well, because I can tell my children, you can tell from your own children when they're getting a little bit stressed from it. Mm-hmm. So there's that. The thing I think is being home, so many people are losing our routines. Your routine to go to work, your routine to go to the gym, whatever it is. So one thing I'm telling people is as much as possible, try to retain those routines. If at a certain time you always went to the gym, can you exercise at home? Can you go for a walk outside? The same time you would normally wake up, do that. Try to keep those routines. Make a meal plan. I was sending out an email newsletter today about here's kind of my meal plan for the next 10 days. Have those routines. We as human beings, our brains love it. Our brains love a routine. They love that predictability. Amidst all the chaos, it gives us a little more control and known.
That is so good. Hey, you mentioned your kids and that they might be dealing with their own stress, kind of their own journey through this disruption. If somebody has young children like you do, how do you talk to them about what's going on right now?
It's a fine balance because you don't want them to be scared. I want my kids to take it seriously. We were traveling on spring break a couple of weeks right when COVID was starting to come out, and so I was telling my children then, we're gonna we traveled with the stroller, so I could close it down. I said we're gonna keep this closed because there's some sick people around, and we just don't want you to get sick. And it's amazing how much your kids retain it, because on the way back, my 3-year-old pulled it down and he yelled out, "There are sick people," and closed it. So I think his parents have to be really careful what we say. But I think I'm trying to convey to my daughter, this is something different. This is kind of an adventure. Yep. We don't know how long this will take. Let's figure it out and let's do something new. So for science, I said, for science today, what do you want to do for science? Do you want to not dissect? Look at the anatomy of a worm. She wanted to dissect a worm. Let me clarify that. I choked on some water last night. I said, let's look at what that means going down the wrong tube. So I tried to draw it. My children realize I'm a really bad artist, though they asked me to pull it up online. I think we're trying to find some nuggets of learning, some nuggets of fun opportunities there too. And I think that helps them. I think it helps me a little bit too.
How would you suggest somebody helping to manage the anxiety at home of what they're feeling right now?
I think having the facts about it, knowing, again, that the number one thing, the reason you are home is social distancing, not because this is something, the bubonic plague, that is going to be wiping through our communities in that way, but because it's something that has the potential of being very serious. We are asking everyone to be proactive. That's why they are home. Proactive and actively be helping us so that we hopefully don't reach, we hear this flattening of the curve, we hopefully don't reach, that is the goal, that we don't reach that peak level. In the meantime, we as physicians are working very hard, because the reality is we will get through this. All of us as a nation, we will get through this. It's not going to be easy. For the medical professionals, we're going to be working really hard around the clock. For those who are not medical professionals, we're asking a lot of them too to really stop their lives. I get that. But to know that we will get through this, we're finding new treatments every day, we're trying new treatments every day, and it's going to be a process. I cannot tell people how long it will take, and I wish I could, but we will come out the other side.
It is so inspirational to hear of the ingenuity and the collaboration and the solidarity of what's happening in our medical community right now. And I hope that our larger community actually starts to mirror the commitment that we're seeing from the incredible dedication and sacrifice that's happening in our medical community right now. You're also a wife, as well as a mom, as well as a doctor, and this also is a challenge for a marriage, a relationship. Is there anything that you and your husband are doing differently in order to try to stay connected in this time?
I laugh because since my husband and I are both potentially exposed to COVID patients, we're giving each other air hugs as well. So from an from an intimacy standpoint, we're air kissing. So maybe that's not the very best thing from staying connected, but I think it is important since we have to keep a distance, spousal distance, social distance, spousal distance. I think it is important. We're trying to just check in with each other. Our days are very different right now. His days are very different right now. And understanding from him, they're figuring out, how can I still see patients? Who are my sickest patients? What do I do with my employees? Which so much of our congregation is having to figure out with their employees and work. And I think we're really trying to use this time to check in with each other. How are you doing? What is this day looking like? And then really trying to make sure that one of our anchors of the day is that family time, be it dinner time, be it after dinner, and it's not every day because sometimes I'm in the emergency department, but trying to make sure we have that family time just to sit down together, because we do have this time with the kids at home, and taking advantage of that.
It's great. We had a private wedding ceremony for a bride and groom this week. I was performing the wedding, and it's the only time I've ever said, "You may elbow bump the bride," instead of "You may kiss the bride." And so it is just a different reality for us as couples, as families, to be able to do this together and to do it wisely. Yeah. Is there a way that if someone is appreciating the clarity and direction that you're giving like now, is there a way that someone can help follow you and stay close to the advice that you're giving?
Yeah, absolutely. One thing I've been trying to do, since this news is changing so quickly, I've actually started to do a lot more on Instagram. I'm trying to also post those on Facebook and Twitter, but really Instagram, if anyone's there, I'm trying to make sure that people can DM me or message me or put in the comments their health questions, and then in real time during that day, I'm trying to create Instagram stories to do that. I'm at Dr. Darria, and it's also Dr. Darria on Facebook, Twitter, and my website, so it's easy. But the point is, I know this is changing. I know people have questions that come up every day, and I'm trying to be able to bring the scientific facts, but also a little bit of sanity to all of those answers as much as possible.
Dr. Gillespie, is there anything that we can do in order to try to help to provide for the safety of our medical workers right now?
So one of the things that concerns me most right now is our lack of personal protective equipment. We are running out of them nationwide. Even in my own emergency department, we're being told to reuse masks and only use the special N95 masks when we're intubating a patient. A lot of places are running out. Some places, I was told, are being told to use bandanas. This frightens me because we know that emergency room doctors and doctors and healthcare professionals are at higher risk of getting sicker because we're so exposed to it. So what I'm asking anyone in the public, if you have a company that has large amounts of personal protective equipment, masks, if you happen to be an individual who bought a whole bunch of them, please consider donating them. Donate them to a hospital. Reach out to me, reach out to the church. We'll find ways to get these to the healthcare workers where they are so desperately needed.
My dad sent me 2 of these before I went to India several weeks ago, and I'm going to make sure you have these by the end of this interview.
Thank you so much.
So, Doctor, as people have to go out and about, whether they have to go to the grocery store or to pick up something that's essential, in this time of social distancing, if somebody has a mask, should they be wearing one?
That's a tough question. And I don't know that we know the exact answer. They are saying for social distancing, you should stay at least 6 feet away from people. But if somebody's coughing or sneezing, could the droplet be spread further? What I tell most people, if you're older, if you have chronic health conditions, you probably shouldn't be going out, period. The rest of the audience, I would say, right now, if I go to the store, no, I'm not wearing a mask. Is it a bad idea maybe for families to have enough masks for 1 or 2 people, just regular surgical masks? Not necessarily a bad idea, but really nobody needs more than that. You know, you don't necessarily need to be wearing them right now. And otherwise you can go about your business, unless you're someplace really crowded, which I would say avoid in the first place.
Yeah. So this is a copy of your book that you shared with me a while ago, and even though I'm a dad and not a mom, I got some good hacks out of this. So thank you for sharing that.
You're
with
in
me.
it. You're in one of the hacks.
It is a negative example. This is an example of what not to do, right?
No, don't listen to him.
So my wife says that all the time, actually. So one of the last things I'd love to do is just to ask you about your soul as you go through this. What are you trying to do to stay grounded spiritually through this really disruptive period?
I think what I'm trying to do now is the same way I stay grounded when I'm in the ER. When I'm in the ER, I could be taking care of a trauma patient, and a woman comes in labor, and there's a heart attack and a stroke, and it can be so easy to get stuck in our own heads where you start to catastrophize and worry. And I've learned that the number one way to get out of my own head is to focus on the patients in front of me. And so one of the things, as I'm praying for it, is that I can keep focusing on all of them. What does this person need from me? What can I do for this one? What can I do? Yeah. How can I serve?
We are designed by God to love other people, to care for them, to serve them, and that is when we are most fully alive. And all of us are going to have to get really creative to not just draw inward and to get so self-focused and to get stuck in the cycle of isolation, and make sure that we really are, even though we're social distancing and staying at home, that we really do figure out how to creatively love our neighbor. Doctor, thank you so much for taking the time, for coming to the sanctuary. We really do, as a community, will rally around you and pray for you and others like you as you care for our community. Thanks so much.
Thank you, Rich.